first oral question, Baroness Bennett of Manor Castle.
My Lords, I beg leave to ask the question standing under my name on the order paper.
The Government provides significant funding for the development of these technologies through UKRI, primarily via the National Centre for the Replacement, Reduction and Refinement of the Use of Animals in Research. We're doubling our investment in this area next year to £20 million, and this summer the Government will publish a plan to accelerate the development, validation and uptake of methods to reduce reliance on the use of animals in science.
I thank the Noble Lord the Minister for his answer, but of course we're not finding animal testing working well. Less than 6% of cancer drugs proceed past the first small phase 1 trials. Alzheimer's drugs, more than 99% have failed. And there's some very exciting possibilities, such as the liver-on-a-chip device that correctly identified 87% of drugs that cause liver toxicity after they passed animal tests. Many other countries are racing ahead on this. The USA has passed the FDA Modernisation Act. The Netherlands has a transition program. India has new rules for drug trials. Don't we need to go much further and look towards legislative change and a much bigger injection in funds to see real progress if we are indeed going to be world leading in the future in this biotechnology field?
Well, it's a wide-ranging question, and I'll do my best to cover some of those points. First, with respect to clinical trials effectiveness, the no clinical trial, or on the whole, clinical trials can't take place without toxicology trials, and most of those, sadly, have to be done on animals. We do welcome very much any technology that allows for in silico methods of assessing toxicology. And it's true that more of those are emerging, but they have to be validated in order to be assumed to be safe and usable in clinical trials.
The Government produced a previous report on a roadmap for non-animal technologies from 6 UK government funders, including MRC, EPSRC and Innovate UK, way back in 2015. How will it ensure that this new roadmap does not itself get left on the shelf again, my Lords? And will DCIT set up an independent strategic advisory board with the key stakeholders to provide direction and oversight, as suggested by the RSPCA?
Well, DCIT continues to be led on its approach to creating non-animal methods in the clinical trials, toxicology trials, and so on, by the UK, by the NC3Rs, that is the National Commission on Replacement, Reduction and Refinement of uses of animals for toxicology and other scientific research, and that continues. There was a decrease of 10% in animal testing from the previous year, according to our most recent records, and that will continue. DCIT, meanwhile, has no plans to add a new oversight executive body to those already in existence.
I express an interest as the past chairman of NC3Rs. During the time I was chairman, we did see a marked reduction in the number of animals used in research, and that continues. Certainly certain types of animals, like dogs and cats and so on. It is essential, though, for new drugs to be tested in animals. Regulatory authorities rely on that. Is there anything we can do to help the regulatory authorities to relax a little?
Yes, first let me pay tribute to the work of the NC3Rs. It's an extremely important body. Nobody feels comfortable doing a lot of animal tests. They simply are necessary for human safety in too many cases. But yes, I think, for example, the UK REACH follows the last resort principle, where, as far as possible, it's able to waive animal tests for chemicals. And I think that kind of work will further accelerate the work of the NC3Rs.
My Lords, the Noble Baroness Bennett spoke about other countries that were looking at alternatives to animal testing. What conversation has my noble friends, the Minister's Department, had with other countries in terms of how they can encourage more alternatives to animal testing?
Well, DCIT continues to arrange to engage on life sciences research with a wide range of other countries. Countries that have tried to accelerate further, in particular, recently the Netherlands and the United States, have not always been able to succeed in their goals of accelerating the date by which non-animal methods of research become the only way forward. On the other hand, slow or rather steady progress towards the greater use of non-animal methods through the 3 Rs does seem to be bearing fruit, albeit not as fast as anybody would like.
My Lords, we know that there's a fast-growing global market for human-specific technologies. The size of the global market in 2023 was around $2 billion. This is a huge market. So I wondered if the Minister has any views on the economic potential of human-specific technologies for the UK as a leader in this field.
Yes, indeed. I think the economic potential is absolutely enormous. As with any medical devices, they need to be put through proper pharmacovigilance procedures, validation testing, to make sure that by the time we're ready for clinical trials, then all the toxicology testing has been properly done. Where it's possible to find an alternative to animal testing, that should always be followed, and we always aim to use the minimum number of animals for the scientific benefit to be achieved and minimise the potential harm to animals for that benefit.
My Lords, the Noble Lord the Minister responding to me referred to the apparent necessity of animals for toxicity tests. Of course, the case that I had cited was a case of liver drugs that had passed animal toxicity tests and then were found to have problems with a human-specific technology. And Canada has passed a bill to phase out animal-based chemical toxicity testing, and the European Commission is committed to developing a roadmap in that direction. As the noble lady on the front bench said, human-specific technologies have enormous potential. Would the government look towards getting an act to provide a framework so that the UK could get ahead in this area and indeed end toxicology testing on animals, as other countries are looking to do?
Well, the noble lady mentions an act, and we do, of course, have the ASP Act, the Animal Scientific Procedures for Act. Protections under that Act are widespread. We have the 3-tier licensing system, including significant training and assessment for licensees, and a range of other safeguards. Different jurisdictions are taking a range of approaches to this. I'm not aware of any jurisdiction that has yet been able to set a timeline for the absolute removal of animal tests, because sadly they do remain critical for the development of medicines.
Question, Lord Leon.